Hi, it's Dr. Bette Robin with the Dentistry Rising podcast. I'm an attorney, a dentist, and a practice cell broker. This podcast is my brainchild to help inspire, motivate, and educate dentists to create the practices and lives they want. I've personally owned 3 practices and worked with thousands of dentists in my capacity as their broker or attorney. I want to put my expertise to work for you and help you find the success you want. After all, you're my peeps. Let's get going. Today we're going to talk about how to get your treatment accepted. I'm going to break this down into 3 parts. So this is part 1. Essentially I'm going to teach you the secrets of the universe. Well, at least how you get treatment accepted almost every time. I know some of you don't like the word sell, but that's what it is. However you can substitute sell with present treatment or simply tell a patient what they need. This is really simple, but so many of you don't know how to do it or don't do it. But once you learn it, I'm very confident that with a little practice, you'll do great. Now, don't just listen to this. After you listen to this and my 2 ones coming up, try it yourself. Videotape yourself or work with a partner and practice presenting treatment and getting it accepted. Because like anything, when you practice it, you will get better. But I really think selling treatment is simple, predictable, and I do think you can do it. Every single one of you. Some of you might not like all these steps, but just try it. And I think you'll have great success. And you will like that. Okay, part 1. Look like $1 million. When you go into Target compared to when you go into Nordstrom or Neiman Marcus, you get a different vibe altogether and a different look. And most importantly, different prices. You need to look like where you want to position yourself in the market. And whatever choice you make, stay consistent. Everyone is very visual, so let's start with your clothes. All of you, male or female dentist, in my opinion, must wear a uniform. Not a uniform in a traditional sense, but you need to look like a professional dentist and have a uniform that matches that so you can sell professional high-end treatment. You know what your FedEx driver wears when they make deliveries to you, and you know what attorneys look like. And even courtrooms have dress requirements for attorneys. You should look like a professional dentist. So you may call this your monkey suit, and that as long as it works, it doesn't matter. Okay, for men, your uniform consists of a white shirt, generally long-sleeved. You can wear short-sleeved if you really want and you wear your lab coat all the time. But generally a white shirt, long-sleeved. You must get it professionally laundered and starched after every wear. And you probably should buy the highest quality you can afford. So it not only looks good, but can be laundered many times before you have to replace it. Your pants should be slacks, not jeans, not khakis. Slacks. If you saw an attorney in khakis, you wouldn't think of them as that professional or as good as someone with slacks. Color's up to you, maybe gray or so they don't show the glove powder or whatever else lands on you during the day, but some kind of plain color. Now, if you're in a really remote, like farming community, yes, khakis might be okay, but again, you want to get them laundered and starched. So you also have to get your slacks dry cleaned after every wear. Even if they aren't all that dirty, they'll smell. And since your patients' heads are almost literally in your crotch, you absolutely must get them dry cleaned every single time. Now, most of you should also wear a tie. I know many of you guys don't want to hear this, but if you want to sell a $25,000 veneer case, I'd absolutely recommend a tie. You want to look professional. No one gives large sums of money for a professional service to someone who looks sloppy. Let's move on to your feet. Socks are a must, even if you don't like to wear socks, as are very good quality shoes. You need 2 pair at least, and they must be professionally polished every single week. No scuffs, no worn down heels. I mean, you can usually get that done when you get your car washed or at Nordstrom's if you are shopping, but there are also services that'll come and take care of your shoes. So you're going to buy at least 8 shirts if you work 4 days a week or 10 shirts if you work 5 days a week, whatever, and the corresponding number of slacks and socks. I don't care if you buy them at Costco or Neiman Marcus, but you need to buy them and wear them. And if you don't buy good quality, you'll probably have to replace them sooner. But if you just want to try out this idea, stick with the cheap. Okay, for women, kind of the same thing. You want to wear a white button-down shirt is best. But if you're too well endowed to really make that work, a plain silk shell is fine as well. But you want something professional. You want something that's your uniform and that you only wear to work. And definitely no cleavage at work. It just isn't professional. Now, your bottoms can be either a skirt, a knee-length skirt, or pants, or whatever you want, or mix it up. A skirt should be A-line, so it's easy to sit in and doesn't rise up every time you sit down. I mean, you're not trying to pick up people at work. You're trying to sell expensive treatment. So you want a plain colored pants or skirt, again in gray, navy, black. If you do wear a skirt, you need to put something on your legs, like navy tights with your navy skirt or something like that. Bare legs are not appropriate for a professional at work, and nor do you want random saliva landing on your legs. Now, shoes are important for women. I see all too often women wearing either tennies or 5-inch heels at work. Neither one is appropriate. I don't care if you're wearing $500 tennies, which I've certainly seen, or $1,000 Louis Vuittons. You want to look like a professional doctor at work. So heel height is very important and should never exceed 3 inches at work. Like Ferragamo low heel shoes are really the perfect look, or some kind of copy of that. You aren't going to the club, you aren't trolling for men, look professional. And I know because I've made all these mistakes. I know you don't want to look like your grandmother, but you're playing the game here to get the big bucks. So dress the part. You can wear whatever you want when you get off work. I've broken all these rules. One of my consultants told me everything I wore was too tight, too short, too low, and go get new clothes before Monday. And she was right, and it definitely helped with treatment acceptance. Now that both men and you women are appropriately dressed, both of you should wear a 3/4 length lab jacket with your name embroidered on it, on the pocket, every day. It also has to be professionally laundered and starched. And yes, you need to change it every day. Now that you look the part, selling a $20,000 or a $50,000 or a $100,000 case isn't out of the question. And I do think it is out of the question when you look sloppy or haphazard. Okay, but I'm not through. Grooming is probably the most important thing we're going to talk about today. All of you must shower every morning. Note I didn't say night. If you want to shower when you get home, that's great. You probably should. But to go to work, you must shower. A night shower is not in the place of a morning shower. Why? Again, because your patients' heads are very, very close to you. Close to men's crotches, close to women's stomach and chest, and sweat is not a good smell. In fact, it's a horrible smell. That's why you have to be very meticulous about being very clean in all respects, because if you smell, someone isn't going to buy. After odor is taken care of, let's talk about other kinds of odor. Don't wear any perfume or anything with any kind of smell. All your grooming products, deodorants, lotions should be unscented. And of course, all you men should shave every morning and probably not have facial hair. There are numerous studies on facial hair. Google them and read it. If you want to sell your treatment, be clean shaven. And men, you should probably get your hair cut every 2 weeks and a manicure every 2 weeks. Just put it on your calendar and do it. Look sharp, feel sharp, and you will sell treatment. Women, the same thing. Nails every 2 weeks, and your nails should never be long and should barely extend beyond the tip of your fingers. I mean, that's how you work with your hands. always they should be painted in only a natural or clear color. And women, get your hair done every 4 weeks, whether you think it needs it or not. Never, ever, ever have roots if you dye your hair. All this you think may not need to be said, but I beg to differ. I go into a lot of offices, and I think it really does need to be said. I can also tell you when I see doctors producing well over 1 million, well over 2 million, even 3, they look totally sharp, regardless of their age or location. Looking good changes the way you present yourself to patients, the respect you get, and just the way patients look at you and act towards you. You are a doctor. You took a long time getting there, so look like one. Okay, lastly, make your office look like $1 million. Sometimes that's not completely possible, but it can always look very clean and very organized, and you can control that, and you can afford that. Cleanliness and organization get you around a lot. If you don't own your own office, you can control your own room. And I doubt people will complain if you tidy up the reception room too. Okay, a little bit about the reception room. Everything, again, should be neat, clean, and uncluttered. You absolutely should not have magazines in your waiting room over 3 months old. I just called a doctor out on that after I picked up a magazine over 4 years old. And he told me the patients enjoy them. No, I said the patients don't enjoy them. They might look at them and not immediately notice the date, or your old magazines might be their only choice. But again, they speak about who you are. Throw them away, take them home, donate them, whatever you want to do with them, but get them out of the office. And magazines should be for your patients, not you. If you like golf magazines, get them at home. But pick 5 to 6 magazine subscriptions that most people in your patient pool would generally like. Think about your patients and not yourself. Also, everything in your front office, reception room, and the front office area should be completely clean. Baseboards, the inside and outside of your front doors, your windows in and out, and of course your bathroom. Surfaces should be uncluttered and sticky notes hidden. Look professional, and you'll get higher end patients who accept more treatment. Okay, some of you are saying, okay, Betty, well, I accept Denti-Cal, so how does that work? I don't care if you accept Denti-Cal or HMOs or whatever kind of insurance. No one wants to go to a dirty dental office with a sloppy dentist. Okay, I'll quit preaching for today, but that's my number 1 in the series of 3 of how to get people to accept treatment. Look like $1 million and make your office look that way too, at least in terms of cleanliness. You know, sometimes it really is that simple. You have to decide what you want, but start with how you look and how your office looks. Thank you for listening to the Dentistry Rising podcast, Dr. Bette Robin. Please subscribe on iTunes so we can get better and better at helping you make your practice dreams come true.